Well, welcome. I'm Michelle Dellene. I'm the president-elect of AASPA. I have here with me today Erin. She's the immediate past president as well. And I have two amazing students from Yale. So welcome, Liz and Cordelia. As we move through this student networking event for the next hour, we'll have students kind of chime in, and I'll ask you guys to informally introduce yourself, share a little bit about you, and answer any questions that you have. So, without further ado, let's get started with you, Liz. If you could tell us where you're from and why you started your career in medicine as a PA student and what you aspire to be, what specialty you wish to practice in.
Oh gosh. Okay. Um, I'm Liz, originally from New York City. And I decided I wanted to be a PA because I wanted to be more involved when it came to managing patient care, all of that stuff. I felt like there was just a wall that I was hitting when it came to my old position, and I just wanted, yeah, like I said, just to be more involved in what was going on. I worked in a plastic surgery service at a cancer hospital. So they had a lot of PAs that they worked with there. And I was just I really admired kind of the split that they had when it came to working in the OR, but also managing long-term patients and things like that. And I thought that was really interesting. So, I mean, I don't know for sure what specialty, but hopefully some sort of surgical specialty is what I'm currently looking at.
Oh, that's absolutely amazing. Well, welcome, welcome. And I'm so curious, what was your previous position?
I was a clinical research coordinator,
Hmm.
so working mostly with lymphedema patients. So it was a lot of breast cancer related lymphedema and things like that.
Yeah, that's incredible. I love hearing about everyone's diverse backgrounds. I started as first a certified nursing assistant and then a medical assistant, and I kind of jumped all over from like primary care to urology, and like none of that stuff was ever really super exciting. I always wanted to become a neurosurgeon. I didn't even know what a PA was. And then I heard about what PAs can do while I was studying at the University of Florida, and I'm like, oh, I definitely want to do that. And I practiced in neurosurgery right off the bat in trauma neurosurgery, and now I'm practicing in outpatient neurosurgery, which is very rewarding, and I get to sleep, which is lovely. Um, but I have to say that everything that you do before PA school definitely prepares you well for what you do as a PA. I mean, especially in your previous position, working with like lymphedema patients, no matter what you decide to do, you know how to communicate with patients, you know how to utilize your community, and you have so much experience and wisdom that you've already gained through this previous experience before PA school that you'll be able to apply. So I know you're kind of unsure of what specialty that you'd like to jump into, but do you have any like specific curiosities or interests as you've been studying?
So we're only like, oh gosh, I don't even, like a month and a bit in, so we haven't really covered a ton of stuff yet. And My experience was mostly just with like plastic and reconstructive surgery. So that's kind of like all I know.
Mm.
So I just interested in hearing more about what the different options are.
Okay, cool. Yeah, so I'll tell you a little bit about what I do, and I'm sure Erin can chime in if she's available too. So I work right now in outpatient neurosurgery. Right now, I'm seeing probably anywhere, it depends on the day, but like 20 to 45 patients a day. We also partner with an orthopedic surgeon, so we do a lot of like injections. So you're utilizing your hands, putting your hands on people, you're helping them immediately, which I really love with surgical subspecialties is that you're able to get that like immediate relief, which in other areas of medicine, it can be hard to obtain. So Surgery is probably my most favorite thing. Like doing the trauma neurosurgery right off the bat after PA school was everything I ever dreamed of, and I'm so glad I did it right away. But it was taxing. Like I was on for 14 days in a row with like no sleep, and after day 4, like not many people can sustain that kind of lifestyle. Like forget where you are, and you're like, did I brush my teeth? Like, is today a new day? Like, I'm not sure. I've been up for 4 days. It's just crazy. So I'm hoping that the laws get a little bit better, and as PAs continue to like stand up for each other and advocate self-care and really like workable hours, that changes, and that does not remain the culture of trauma, but it still remains very much, at least here in Florida. So, Erin, if you could please tell us about what you do.
Yes, I would love to. Um, so hello, Liz. I was listening to your background, and I'm a New York City-based PA too. So, um, I'm assuming maybe you were at MSKCC. Yeah, I just figured by your story. It's a great place to work, super PA friendly, and I'm so glad you had experience there. I mean, it's a wonderful, wonderful start for your career. Um, my background, so I initially went to school to become a registered dietitian, and I'm very passionate about nutrition. And after there's a required internship in order to become a registered dietitian. And while I was doing the internship, I was rotating through the hospitals, and that's when I was first exposed to the PA profession. And I was kind of like, huh, that's interesting. I never even heard of this profession. And I kind of think it's interesting. So I was really fortunate and had an opportunity to do some shadowing just by I worked with a lot of PAs, and I asked, hey, can I tag along? I did some shadowing at a family practice center, and um, I decided that I really wanted to do that. So I applied to different PA schools, and I'm originally from Michigan, but I ended up going to PA school at Weill Cornell, which brought me to New York City. So um, I I don't know if you guys know, but Cornell is like a surgical focus type program. So you do have some extra rotations in surgery. And I didn't have a ton of OR experience beforehand, but I really was excited about procedures. And I like this story because I'm sure it'll happen to some of you unexpectedly as well. But during my very first like surgical observation, I got lightheaded. And it actually was at MSKCC during breast surgery. It was my very first time like in the OR as a PA student. I was so excited. I got myself gowned, gloved up, and they were doing a lot of bovying, which is electrocautery. Because it's breast surgery and there's a lot of tissue that they have to cauterize. And there was a lot of smoke in the room, and I just started feeling hot. And I had to excuse myself, and it was completely humiliating because I wanted to impress them so much. But it was what it was, and they were all so kind to me. And the rest of the rotation went fine there. But so yeah, I had a great experience. The rest of PA school, did a bunch of different surgical settings. And then after I graduated, I took a job in the surgical ICU. So I did a lot of critical care, and that was similar experience to what Michelle explained. It was very high stress. I had a schedule that was kind of like 7 on, 7 off, slightly different than that, but it was sort of like you live at the hospital for a week, then you get, essentially a week off, which was great, but you were kind of on like 24 hours while you were doing that intense stuff. And I was so nervous that I was going to harm a patient during my time. I didn't sleep well, that first year as a PI. I was very stressed out, and it was excellent for learning. I had a great foundation of surgical, critical care information. But after that, I switched and ended up switched hospitals, and worked in emergency medicine, which also was filled with procedures, lots of hands-on. And that was, a great place to be as well. Lots of learning opportunities. You see pretty much everything there, and you're still connected with the surgeons. So currently, I went back to school and did my doctorate, and currently I'm doing a research fellowship. So I'm not working clinically, but I'm still really passionate about surgery and procedures and educating the next generation of PA students. So I'm happy to be a resource for you guys, especially, those of you that are at Yale. You're very close to New York City. There's a lot of, you'll see if you come back to any of these, there's usually at least one or two PA students from the New York City area. So there's a big network of PAs in our area if you're interested in like tri-state opportunities.
Absolutely incredible. Thank you so much, Erin. I have to agree with you. My first ever experience was like an IND with the primary care doctor I was working with. I became very nauseous and, like she said, like super hot. And I was like, I think I'm gonna faint. And I told the doctor that I was working with, and he's like, well, we don't need two patients. Go away. Step outside the room, excuse yourself. And I was like, I felt the whole world crashing down on me. Like, this cannot happen because, like, I want to operate on the brain. Like, if I can't do an IND, how can I do this? And I think one of the beautiful things about just kind of trusting the process is my first surgical rotation was in colorectal surgery. And the surgeon that I worked with was just so extra over the top, very enthusiastic. And here I am, like Erin was, all gowned and gloved. I'm like clenching my fist so hard, white knuckling it because I'm just so scared, which is not helping the situation, right? I'm like, breathe. I'm just getting like hotter. And it was an open exploratory laparotomy, and the patient had like multiple intra-abdominal abscesses. It was a hot mess. And he grabs my hands. He goes, are you ready? And I'm like, what? And he puts my hands in the belly and he shakes it. He's like, do you feel that? That's not normal. I'm like, oh my God. But I think it was just the over flooding, like the desensitization. That's everything I needed. And it was just such a rush to be inside of a body, like, like mid forearm, like deep in a big belly, and to feel like the warmth and like the intestines. And I was like, oh, this is crazy. And then, of course, it was just so short lived. And it was on a rotation where there was a lot of colorectal surgical residents, there were medical students, there were PA students. So we all had to really show up and give it our all in order to get that hands-on experience. And so for the rest of the rotation, I was just like kind of like on the sidelines, like, can I like do something again? Like, I'm so ready. So don't be afraid if you ever feel like lightheaded or faint. I feel like I'm just a big believer in desensitization, and eventually it will happen. And if not, no worries, you do it multiple times and it doesn't work. There's so many other specialties. And the cool thing about being a PA is like, as a physician, you graduate medical school and then you go through residency. Like, that would totally be a bummer if you couldn't operate and you're a surgeon, right? Like, you just have to like get over with, just figure it out. But as a PA, you just have this beautiful opportunity to transition. Like I told you, I started out in trauma neurosurgery. Then I went into aesthetics. I did fillers like Botox, or more like Restylane, Juvederm. I also did botulinum toxin, Dysport. I did lasers. I did all sorts of stuff. It was fun for about 6 weeks. At this point in time, I had a baby because I was like, okay, well, mommy needs to sleep sometimes, so maybe we can do something with like a schedule so mommy can actually plan her sleep. And then I was like, okay, this isn't really my passion. There are really passionate PAs that love this, but I felt like I wanted to do real medicine, quote unquote. That's just how I felt. Like I wasn't really helping the people that I wanted to help. So then I transitioned into general surgery. We did a lot of robotics, a lot of hernia repairs, breast cancer surgeries. We did thyroid surgeries, lots and lots of gallbladders. And there was a really cool variety of cases and so much autonomy in the OR, in the clinic, and taking call, but it wasn't trauma call. So that's the beauty of being a PA is you can switch. And if it's not serving you and your lifestyle or your family, or it isn't setting your heart on fire, then please change, because there's so many amazing specialties out there to pursue. And if you want to advance your education, that's available to you too. So, I have not been ignoring you, Tracy. Welcome, welcome. I'd love to hear a little bit about you, where you are in your PA student career, and what specialty you aspire to practice in.
Thank you. Thank you for having me. This is actually my second time coming to one of these. The first time I came, I was about 2 months into like my first semester. So everything was still new to me, still fresh. I'm Tracy. I go to Erin's alma mater actually, Weill Cornell in New York City. I'm in my final semester, which is crazy to think about. But yeah, it feels like I just started. Time does go by really, really quickly. Still neurosurgery is like on top of my list. We're slowly getting into neurofundamentals now. And that's been pretty cool. Um, but also neuro-onc as well has been like something that I'm interested in. And Erin, you mentioned working at MSK. So I was actually pretty interested in knowing what it's like over there. Like you said, I've heard that there's a lot of great opportunities for PAs. So that would be like really interesting to learn more about. But yeah, that's been my journey so far, almost done with didactic and going into clinical. So really heavily thinking about rotations now. And hopefully I get to do a lot in like different surgical subspecialties, because I do know that I want to do something surgery. But with even though neurosurgery is high on the list, I still do want to like check out all the different ones that can be offered. So yeah.
Awesome. Thank you for that amazing introduction, Tracy. And congratulations on making it. Like, that's a huge accomplishment. And
Thank you.
it's going to be absolutely refreshing when you enter clinicals. Like, it's just like a whole new world, right? Like, you're just like out in the real world again and interacting with patients, putting your hands on them. And I feel like you'll really be able to kind of navigate through these different surgical subspecialties that are offered to you. So, do you have any idea of where you want to do your elective or surgical rotations?
So I definitely want to do neuro-onc in at MSK if I can, just because I have heard really great things about um the teaching that they give over there. Also I think at Weill Cornell I do want to do general surgery because I think for most of the locations they do this like sectioning thing where it's like red, blue, green, and stuff like that. Like the different surgeries are like colored,
Mm.
and each color represents like a different subsection of surgeries, like abdominal, and then like I don't know, maybe chest. I don't know, cardiac or something. So I definitely want to experience general surgery at Weill Cornell, and cardiothoracic surgery at Columbia. I heard is also really good. So I want to do something there as well.
All right, Tracy. So what I would recommend, definitely do neurosurgery at Weill Cornell. So I did it there. I mean, I did it a while ago, so it's probably slightly different now, but first day I was able to, saw the skull, kind of an amazing feeling. You're like, really? You're gonna let me do this? I've never done this before. And then they do a lot of microsurgery, like the microdiscectomies and stuff. So you get kind of used to looking through the microscope, and the schedule was manageable. So I would recommend that, rotation. Columbia cardiothoracic, I would totally recommend that too. Even though Columbia is kind of hard to get to from where you are, it's a fantastic rotation. And they do a lot. They have a great program there. and then any rotation you can get at MSKCC. It doesn't have to be neuro-onc if you can't get that. Breast is good, plastic is good, thoracic is good. Really just kind of getting yourself in the door there is great experience, because it is a very PA friendly institution, as is Cornell and Columbia. Like I said, a lot of those NYC hospitals are very PA friendly. So yeah, take any rotation you can at MSKCC, and then just be on your best behavior, and while you're there, try to make the connections that you can, if that's something you want to pursue. I don't know if you want to stay in the New York City area after you graduate, but that is a wonderful place to work. I can't say anything really terrible about any of the institutions in New York City. A lot of them are big teaching hospitals. So they do, sometimes the salaries are a little bit lower in the bigger academic institutions. However, great place to learn, because you're working with some of the best of the best. You have residents that you work with, fellows, really a lot of opportunities to see innovative procedures and research and things like that you might not see at a smaller institution. So when you get to that point in your decision-making process, we can always provide guidance then too.
Thank you. Do you have any sort of like tips on, like you said, it's like teaching hospitals mainly, and so like there's like fellows and residents. It's hard to stand out as a PA and much more PA students. So do you have any like anything that I can like put at the back of my mind right now?
Show up early, read the night before, read up on the cases that you're going to do, try to participate in rounds, be an active participant in your rotation, even though you're tired. Show effort, and that you're enthusiastic, and that you want to be there. And I think Michelle can add value to this conversation, because she is very has great resources when it comes to how to make yourself stand out as a student.
Thank you. I was so curious to hear what you were going to say. I am extra, if you want to know. If you want to stand out, definitely have that strong personality. But it comes from the enthusiasm. Like, I love medicine so much. And honestly, like, as a student, you can only digest so much in such a short period of time, but if you show up and you show them how passionate you are and how you're willing to learn, even, if they ask a question and no one says anything, it's crickets, raise your hand, make your best guess. Because that type of effort does not go unnoticed. And I always created business cards, and I would put like my name, my email, my phone number, that I was a PA student, my school, and on the back a cute little quote from like Hippocrates. And I just passed them out. And like you think that you may never actually hear a phone call or receive an email from someone, but I have like really long lasting relationships with some of the preceptors, and I had an incredible neurosurgical elective rotation because I did that like during a volunteer event. So do that. Do anything you can to set yourself apart from the rest, but authentically be you, right? So never do anything that's not like your personality, but it should push you to grow. Like for me, I would say it was never comfortable. I always had like butterflies in my chest and my throat and my belly because I was so scared. I didn't want to say the wrong thing. And so read the room. I believe as PAs and PA students, we're very empathetic and sensitive individuals. That's why we're entering into medicine, so that we want to help and heal people. And we have that incredible ability to connect with the energy in the room. So before you go, shout out loud, raise your hand, say something crazy, just like check in, like, is this the appropriate time? I think that really will serve you well. And then on your surgical rotations, like, jump into the OR before the case if you can. Write your name on the board so that the circulating nurse knows who you are. If you know your glove side, get your gloves ready so they don't have to pull it. And when you're scrubbing in with the residents, other medical students, other PA students, and the surgeons, make sure you are scrubbing in like the longest. If there's a surgeon who like comes up after you, you keep scrubbing until they're done. Because the worst thing to do is to like finish too early and they're like, no, like you can't operate. I watched you scrub in, and then that was definitely not up to my quality. So when in doubt, scrub longer and get all of your stuff ready. Like Erin said, show up early, read about the cases. If you know it's on the schedule tomorrow, usually there's someone at the OR front desk and they can print you the schedule tomorrow. Then you can go on YouTube if you want, look up cases. You may find a weird operation from outside of the United States. It probably won't be the same, but you may pick up a few different things. Um, and always think 10 steps ahead. Like in the beginning, when you're watching a surgery, everything is pink. You're like, it's just covered in blood. Like, I don't really see anything. I know, like, the liver should be here, and I know the intestines should be here, and like, but I just see blood, right? And so the brain is consistently rewiring, and the reticular activating system is fine tuning, fine combing through everything that your visual system is processing through the occipital lobe, right? And so repetition is key. The more you repeat in the practice, in the elective rotation, in the books, talking to people, and then, at home watching videos, the more the brain is able to pick up on things. And so I'll provide you this example. When I first started working in trauma neurosurgery, my supervising physician, Dr. Shaw, he was so great. He was a surgical or a chief resident before, so he just trained me like a resident. And he goes, "Do you see that?" And I'm like, "Yeah, it's the brain." He's like, "But do you see that? Like how this part is dead and the rest of the brain is alive." And I'm like staring at the brain like it all looks the same. And I felt so defeated because like I just couldn't see it. But this is very much how we all see it in the beginning, right? And then with that fine tuning, combing through, refining over and over, about, I would say, 100 surgeries in, I was like, I see it. And they're like, "Why is she so excited right now that she sees like dead brain?" I'm like, "You guys, it took so long to get here. And every surgery, I just thought it would be the next surgery. But it took about 100 different cases for me to finally see, instead of it being kind of like a gray, pink, that's very um, vibrant and full and pulsatile, it is a bit more dull and gray and dusky and sunken in, very subtle, but I could see the margin well defined, and I like, it's exactly right here. And you come in with, all these different tools to confirm lack of blood flow, and there it was, like exactly as I saw it. And I was like, "Ah." So don't get defeated. Repetition is key. Give your best, show up early. Don't be afraid to raise your hand and chime in, even if you don't know the answer. And don't worry, as long as you do your best and your heart is in it 100%, you'll be successful.
Great
Thank
advice.
you so much.
I wanted to just bring up some of the points that Cordelia had asked about. Hi, Cordelia. So you are at Yale as well. Are you in the same class as Liz? Okay. And are you guys in the in-person program or the online program?
Yeah, we're in the on-campus program.
Okay, perfect. So Cordelia, you have a background in ER. Yay, so do I. Yeah, surgery and ER overlap a ton. So any ER experience that you have, I'm not sure what you did in the ER, but there is a lot of similar practices in the emergency department. I'm constantly, repairing lacerations, using sterile technique, collaborating with the surgeons because I've examined someone and I'm convinced they have an appy or a gallstone. So there is a lot of work that goes hand in hand between those two specialties, and a lot of overlap, I would say, in procedural skill level. You use your hands a lot in both areas. So it's excellent experience for, really anything you want to do in medicine. Orthopedic surgery specifically. So I don't have a ton of experience in ortho. I did a rotation in it, and the rotation I did was interesting. It was a lot of knee surgeries. And so there were a lot of, I hate to say it, but it was slightly stereotypical in that there were some like big men who would kind of be holding the knee in place. And then I was, this petite person who kind of didn't have the best role in there. However, my roommate in PA school is also a petite female, and she works in orthopedic surgery and has ever since she graduated. And she loves it. So, you just have to find your niche if it is orthopedic surgery, whether it's hand, knee, hip, whatever body part you want to do, or if it's a combination of those. But yeah, I can't say too much more about orthosurgery. Can you add to that, Michelle?
Yeah, most definitely. Ortho is like what Erin said, it is hands-on. If you're ready to get like dirty, like splattered in blood and use like hammers and drills and like go to work on people's bones, then do that. And if you love fixing things, like it is very mechanical. I would say it's probably like the most mechanical, like out of all surgery, because you're like working on the most dense pieces of the body, bones, right? And fixing like fractures. And there's this one YouTube bit. What is it? Something like anesthesia versus ortho. Have you seen that, Erin? Oh my gosh. Okay, it's the most hilarious thing. If you're, going insane from PA school and you just want a break, just Google anesthesia versus ortho. It is this like robotic type of um, I don't know, it's hilarious. I'll just leave it at that. But orthopedics is very simple. And that's what I was trying to portray with this really funny, humorous clip that they showed us in PA school. And that orthopedic surgeons really just want to operate, and anesthesia is like, well, you can't operate because the patient's dead. The guy's like, I have a fracture and I need to fix it. And he's like, well, the patient's in asystole. And they're like, I have a fracture. I'd like to fix it. So, but orthopedic is very straight to the point, and there's like only so many ways you can fix something. And if you like that type of algorithm and consistency and rhythm and hands-on mechanical correction, then go for it. That's been my experience and what I've observed in orthopedics. Now, I'm sure that changes on where you practice. And it seems to be very simple. Like in the beginning, you try all the conservative things. If it's not like an acute fracture that needs to be corrected right away, like rest, ice compression, elevation, doing NSAIDs, different lifestyle modifications, losing weight, nutrition. Nutrition is so helpful, especially for inflammatory changes in the joints. And so you'll notice like a lot of these things, like shoulder pain, knee pain, can go away with certain lifestyle modifications. And then the next step is injection. So you get to play with that and doing, different injections, which are always fun in the office. And I do those on a daily basis, and I like those. And then, of course, surgery as a last resort if it's like more of like a chronic issue that has been going on for a while and they've tried everything else. So that's my experience with orthopedic surgery. And if that's something that interests you, definitely pursue it. And guess what? If you don't like it, you can totally change because you're a PA. So, congratulations. I hope that answered your question. What other questions do you guys have?
So also in Cordelia says, Cordelia just said,
Yes, I love these answers. My background is in ER Tech and EMT Ski Patrol. How amazing is that? I also would love to hear why you decided to get your doctorate. Thank you so much.
Sure, I can answer the doctorate question. So, I always wanted to work in PA education, and I did spend some of my career teaching in PA school. And I had an opportunity. So the hospital system that I worked at NYP Columbia, and they offered a tuition kind of, I don't know if you call it reimbursement or discount type program, if you took classes at Columbia University. So I decided to take advantage of that and pursued my doctorate there in health education, and did it all while I was working full time. It was, manageable. It was taxing at times, but definitely a totally different experience than PA school. My experience was a lot less stressful than PA school. PA school is like really intense, that intensity. This was more manageable. It was like a lot more papers, So and tests. I rarely had tests for my doctoral program, but there are several different types of doctorates that you can pursue. Mine was primarily an in-person. There are lots of options for online programs that I've been seeing a lot of people do. And there are different types of doctorates. So it kind of depends on what you want to do. I hope to work in PA education someday. So right now I'm doing a research fellowship in health equity and global health, and hoping to get some publications and network, and taking a little bit of a break from clinical stuff right now because I have two kids, and it's a good schedule that I have right now, so I get to spend more time with the family.
That's amazing. Thank you, Erin. How incredible is that? I love it. Like, okay, Erin is absolutely amazing, guys. She remembers everyone. Okay. She has like an incredible photographic memory, and whenever someone like pops up with a question of like, oh, does anyone know about a rotation here? She's like, I know this person. So start your networking now. Am I frozen or are you guys frozen? Are we good? We're just very still. Wow, that was incredible. For a second, I was like, I hope I'm not talking to nothing. Yeah, but absolutely incredible. Thank you, Erin. I really look up to you, and I wish to pursue PA education one day too. So maybe I'll follow in your footsteps.
I have a question. Did either of you do a rotation out of state?
I did not. Did you, Erin?
I did. I actually did a rotation in Ecuador. So I really wanted an opportunity to do an international rotation. And I also wanted to learn Spanish. So living in New York City, like I said, I was from Michigan, and moving to New York City was like this huge cultural experience for me. I was like, there's so much I don't know, but there's so much I want to learn. And so I really was passionate about, becoming more culturally competent, and I wanted to speak Spanish, and I really struggled. So I had at least one or two rotations at Columbia, which has a higher percentage of Hispanic patients there. And so that was pretty eye-opening for me. I was like, okay, I got to learn Spanish if I'm going to stay in New York City. So I did a rotation in Quito, Ecuador, and it was 6 weeks. And I was able to rotate through a maternity hospital and a military hospital. And I was also able to take Spanish classes while I was there. And it did cost a little bit of money to, kind of pursue that, but it was a really unique experience, and I'm glad that I did it. Um, I have heard of students setting up, rotations in their hometown, like say they want to go back to wherever they're from for a rotation. And I do know some students in my class were able to do that. I don't know what the rules are regarding that at this point in time, and if it's supported or not supported. But I did have classmates that did that because they knew they were gonna, move back home after they graduated. So they had set up a rotation at home to kind of make some connections and network, and see if they liked it, so yeah, that's definitely a possibility if your school allows it. It's, and you do plan to pursue something elsewhere. I think it's a great experience.
Absolutely amazing. How cool. I have to tell you that the predominant population that I deal with does speak Spanish, and I did study Spanish at UF. Because I studied in the liberal arts and science college, we had to be able to speak at least two languages. But let me tell you, everything that I learned was very formal, and people do not speak that way. So there's this really incredible app, Google Translate. You can put on conversation mode and you can change the languages and it will interpret for you. And when you're there with your patient, I know a pretty good amount, but then once I get past like the majority of the phrases that I know and they start speaking really fast, I know I'm missing a few things. So I love to keep that open. It helps me like learn different words in different languages, and it also really eliminates confusion between you and the patient because they don't really understand what you're saying, and you'll notice that like they understand Spanish, but they've never actually been taught like medical terminology in their language. So learning how to communicate with them without using medical terminology is really helpful as well. And like Erin did, submerge yourself in that environment. That's the best way to learn because if you have a translator there for you, or you have some other opportunity to continue to speak your own language, like naturally you're going to do that because it's the path of least resistance. But when you're in the middle of a place where no one speaks any English, well, you're speaking Spanish, and that's the best way to learn. Awesome. So I'm curious, does your PA school, Liz, offer any type of mission trip or travel abroad?
So I think they used to do international rotations, but those are all like on pause right now, as far as I'm aware, because of COVID and everything. So I don't know if they're starting those back up. Um, but I mean, maybe by the time like Cordelia and I start our rotations, maybe that'll be a thing again.
Yeah,
Um,
maybe.
yeah.
Cool.
but as far as like international stuff, I don't think so right now.
Okay. What about you, Tracy?
So when I first came in, no one was doing an international rotation, but I think going into next year, it might be possible.
Hmm.
And if not next year, then 2024 possibly.
For
So I
sure.
am thinking of, I'm originally from Ghana.
Mhm.
So I am thinking of maybe doing something back home because I've heard that recently they've been using a lot of PAs. So maybe doing like an internal medicine one or primary care would be really cool.
Yes, that's absolutely amazing. I want to chime in and let you guys know I went to Nova Southeastern University in Florida for my PA school education, and we were the first class ever to establish a mission trip, and we decided to go to Guatemala. There was about 25 students. We had one PA professor, and she brought along her ER nurse, who was super amazing at like starting all the IVs. We brought a whole bunch of like vitamins and a lot of like dewormers. And we went like talk about like challenging hiking. Like we should have had some type of physical fitness test before we just hauled all of our stuff, like really heavy backpacks up the sides of like mountains where I remember being so high, just kind of like looking down. I'm like, yeah, you will die if you take the wrong step right now. But it was such an incredible experience, so rewarding. Some of these people have never received any type of healthcare in their entire life, and they spoke a language. I'm not sure what it was, but we had translators that would translate from English to Spanish to their native language in Guatemala. So that was really, really interesting to be a part of that translation, to understand like a little bit of like the Spanish, but then learn even more like Spanish to their Guatemalan language. And just to like connect with people, to put your hands on patients, to really practice your interviewing skills and your physical examination skills, and to learn how to improvise, when you don't have all these resources of modern medicine at your fingertips and all these neat tools, like how to actually help somebody with only like five things in your backpack was super cool. I love this. Thank you for dropping that in the chat, Erin. So if you guys are interested in like setting something like that up, I was the immunization coordinator for a program. It took like four of us with just an idea, and then we just started asking, like, hey, would you guys be interested? And you'll just be surprised with like what different professors have said. And they're like, yeah, I've always wanted to do this. And we took about 6 months to gather donations, different medications, vitamins, supplies, And then we gathered everyone together, and then we got permission from our program to take like a week off to travel. And it was a really cool bonding experience with all the PA students. And so I highly recommend it if that's something you guys are interested in.
That's really impressive that you guys set that all up yourselves. I can't imagine all the coordinating and approvals that you had to get while in PA school. So kudos.
Yeah, it was so fun. I think being involved in something extracurricular to help balance PA school was something that was really important for me. I operate much more efficiently when I have a million things to do instead of one thing. So for me and my personality type, that was great. Um, and it was just really fun collaborating with all of these like-minded individuals and just pulling each other together. And then also like learning how to delegate, like when you're swamped and you're like, I can't do this, like establishing your voice and being like, no, I just can't do that right now. And once you kind of level out and you feel like you're strong enough, you're like, okay, let's do it. And we had a really great collaborating team, and everyone was just, and there's always drama in every school, right? But for the most part, everyone really worked really well together. So I'm thankful for that. And they're still doing it. So we started it in 2015, and they're still doing it every single year. So we set a solid template. Um, and if you are unsure about starting something, you can model it after someone who's already done it. Reach out to them. What did you do? Of course, I didn't really find anyone that's done it before, but I just started like, okay, what do we need to do to like go to Guatemala? And so just looking at the immunization schedule. And this is so cool because you learn about it in school, but now you know what you need to travel. So then when you see a patient and they ask you about traveling and immunizations, you have like a leg up because you had that personal experience. So it's very neat. Awesome. So we're kind of wrapping it up here. We have about 12 minutes left. You guys have any other pressing questions or things you're curious about?
Just as like a general PA school question, not like surgery related or anything like that. So Cordelia and I are like a month or so into our program, and it kind of feels a lot like, I feel like everybody says like drinking water out of a fire hose.
Yeah.
Do you have any like study tips or just like any kind of advice for like, I just feel like I'm constantly behind, and I know that's just kind of par for the course, but if you have any advice for like figuring out what information is actually high yield, or like, I don't even know. It's just so much material. We had like 5 hours worth of just hematology malignancies today. So I
Yeah.
just like, it's a lot.
Yeah. Do you have any suggestions, Erin? Okay, no worries. I'll go first and then we'll come back to you. Perfect. So this is the way that I did it. Um, when I was in a class, I would pay very close attention to the speaker. And you can notice when, based on their voice inflection, their body posture, and how they're presenting, when they're really repeating something or they're trying to emphasize something, usually that's going to be tested. So I would have my laptop pulled up. Usually we would have a presentation. I'd have that PowerPoint pulled up and I have the notes section. I would continuously listen to them, engage with them with eye contact, pay close attention to their facial expression, and I'd take notes. I'd write what they would say that was not on the presentation. And then when I would study, I'd go back to my PowerPoint, I'd review the slide, and then I would review the notes. And while this is happening, I could hear their voice in my head, and I like kind of remember, or I'd put a little star or like highlight this section, like they said this like 5 times and they didn't even touch on that. And a lot of the time I've found that like my notes had like the answers to tests that the PowerPoints never really had. And like what you're talking about, the whole drinking from a fire hose, it feels like that if if you're trying to like, for me, if I was gonna read, like I'm just not someone who will like open up a book and read. I will fall asleep in 3 seconds. Like I'm the one who like listens and engages. And then when I study, I like pull up my PowerPoint and I walk around the room and I talk about it. I have to move. And I feel like that's why I'm so good in surgery because I'm a very much tactile learner. So figuring out how you learn and utilizing that to your advantage. And then when it comes to test day, like I'd review everything before the test, making sure that you're getting adequate sleep, at least 6 hours. You're always staying hydrated. I dress up on test day. Like some people would come in sweats. Like I wore professional clothes because it made me feel like good and intellectual, and I felt like I was like ready to ace it. Um, and then always exercising, right? So you don't want to like just keep studying when it's not working because the brain doesn't efficiently work that way. It works best if you ever heard anyone talk about a power hour, which is really like an hour and 20 minutes, is you go hard for like 20 minutes when you're studying or replaying something. Then you take a 5 minute break. You get up, you walk around, get a sip of water, allow all of that to kind of like digest and settle. And then you go back for another 20 minutes and then take a break for 5 minutes. So that is key. And then also proper nutrition. Like if your brain is just like overloaded with caffeine and sugar, which I feel like a lot of us did in PA school, you're totally going to burn out and you're not going to sleep well. So eating fruits and veggies, plenty of water, chicken, fish, things that feel good in the body. Listen to the body because it's always telling you what it needs. Um, and then just find your own way. Like some people like to study by themselves. For me, I'd put up like those adhesive whiteboards with all different colors, and I'd study like the pathways and different drugs and kind of put them in categories and separate them with color and then talk out loud. But some people study best in groups. Some people made study guides. I looked at that and I fell asleep. So just like do what works for you. I hope that helps.
Yeah, those are all great things, Michelle. Unfortunately, I don't think there's really any great answer as to how to study for PA school. I think one of the things Michelle mentioned is super important. You need to find out how to study as an individual. So, some people really do work well in a small group. Some people are visual learners, and some people, just prefer like memorization. So you kind of have to find the right people if you're going to study in a group. It might take you several months before you figure out who you study well with, because some people just they might seem like good study buddies, but then you're doing poorly on your tests. So you need to change it up. So figure out, how you study best. And then, yeah, good luck with the rest. I would say, like, it's just so hard to predict because every teacher kind of has different methods, how they want things done. Some are going to focus heavily on, making you read current medical. Some are going to focus more on their PowerPoints or, some videos or something that they're having you watch. It's just so hard to know what to study best. But I would just really encourage you to keep your body healthy. Just like Michelle said, do what you can. Exercise is so good for just burning off some of that stress, and if you want to listen to medical podcasts or something, or read your notes while you're exercising, that could potentially be another way to study, or you just zone out while you exercise. You do need that for your body. You do need good sleep. You do need to stay hydrated and good nutrition. All of those things can, they're not going to be the answer, but they can certainly, affect how well you do in PA school. And I think Adam Buck is our student liaison. He's one of them. And he had mentioned a few resources in the past that he found particularly useful. He's a student at University of Florida, and he just started his rotations. One of them he said was AMBOSS, which I'm not sure if you guys are familiar with, but it might be worth looking up. I can't remember what the other resource was, but I did just text him. So if he writes back, I'll keep you posted. He had a couple really good suggestions for those people that are more like visual learners, to kind of help you. So maybe, Tracy, you want to add to that since you're just about to start rotations, you might have some good advice too. Osmosis, yes, that's one of the other ones that Adam did mention too. Even though I think they cost a little bit of money, he said it was well worth it for him because it really helped him. So might, if you're, might might be worth it. If you're struggling, you're already gonna have debt. Maybe you won't. Maybe you're in a different situation than I was, but hopefully you are.
Yeah, I can add something. I think for me, when I was in you guys' shoes, the most difficult thing was trying to not overwhelm myself with a lot of resources. I'm the type of studier that studies every single word that the professor says. And so it took me a while and quite a few failed exams to realize that I needed to start early. And this third semester that just started, that's exactly what I did. I took my first exam today and I felt so great about it. So do know that it does take time and a lot of trial and error. And I think the biggest lesson I learned so far is to not be afraid of failure. I think a lot of PA students are so used to not necessarily being on top, but getting really good grades and, being praised about how smart they are and whatnot. So it's really difficult to get to PA school and not be at that level that you want to be in. So I think my biggest piece of advice would be patient with yourself. Don't be scared to try different methods. Talk to people in your class, ask them what they're doing. Try to like figure out who's like on top of the class. A lot of people will like not tell you, but try it if you can figure out who's on top of the class. And you like them, you can form a study group with them. You can ask them, hey, what are you doing? And yeah, just try a mix and match of different things, see what works best for you, I think.
That's such good advice. I love it. Thank you so much, Tracy. Is she saying goodbye? Aw, so sweet. Thank you, Cordelia. Cordelia? Is that how you say it? Yeah, absolutely amazing.
She's one of our new co-class presidents, so
Oh my gosh, congratulations. So exciting. I was also the philanthropy chair in NSU, and that was so fun. Do you guys have student government? Yeah.
yeah. I'm sharing a like a foundation chair with another one of our classmates for Connecticut. So yeah,
Amazing.
for
So one last gem I'll drop is through that philanthropy chair position, I actually organized many different philanthropy events. And we were doing like, I think it was like free physicals at the Orange Bowl here in Orlando. And that's how I met the neurosurgeon that I did my elective with. So very, very cool. Any type of volunteer opportunity that you do, like come prepared, shake hands, take names and numbers, introduce yourself, tell them what you're interested in, ask, who they are and what they do, because I think you'll be pleasantly surprised. And when you act, you know, I'm very much a yogi and I see things from a universal perspective. So just seeing like when you put yourself out there um, with generosity, releasing any expectations, you're bestowed some of the greatest gifts. So you have to ask. If you don't ask, you'll never know. And it could be the person you've always been looking for is right next to you. So take advantage of that. Awesome. Well, thank you guys so much. This has been an incredible hour. I know we had like 30 people signed up and I was super excited, but I love how intimate this was. We really got to connect and collaborate and learn a little bit about each other and answer your questions. So come back next time. We'll be doing this again. And we're totally having an amazing CME opportunity in Houston, Texas next month. I know you guys will be in school, but you can tune in virtually, and there's student rates, which are like, unbeatable. Once you graduate, you'll never ever have the opportunity to pay such little money to attend a high quality CME conference. And when you do graduate, come and join us. You can as a PA if you can get the time off as a student, but we do a lot of like hands-on workshops, doing suturing workshops, both basic and advanced. We have a robot on site, so we're going to be doing robotic workshops. You get to play with that. Neurosurgical shunt workshops, a lot of really cool things, networking events, and I highly encourage you to come out and check us out anytime, whether that's in your student or your professional career as a PA. All right, so I want everyone to smile and wave. I'm going to take a picture. Let's see if I can do this at the same time. Say cheese. 1, 2, 3. Fabulous. Okay. I'll send that via email. Thank you guys so much for joining tonight, and have an incredible rest of your day.
Thank you so
Thanks.
much
Good
for
night.
hosting.
Bye.
Bye.